Hey, so whenever a new medicine comes out, here come the calls and the emails and everything. Dr. Surin, is this going to work for my hair loss? Sometimes it will, sometimes it won't. Again, it depends on the type of hair loss you have. So a lot of the FDA approved medicines that are out there for hair loss specifically. I mean, you got your topical minoxidils, your Rogaines, they're over the counter, right? And when you come see me, or you come see a dermatologist, sometimes we're going to zhuzh up that topical minoxidil. We'll send it to a pharmacy where you can get a higher dose to stimulate a little more hair growth. Sometimes we do oral minoxidil, totally different. But the ones that you see out there that are recently FDA approved, that are JAK inhibitors or things like that, Janus kinase inhibitors, the inflammatory molecule that causes you to lose hair, and amongst other things that it can do to the skin and the body, those are approved for alopecia areata. Now, alopecia areata is when you see discrete circles, round circles of hair loss, like smooth as a baby's bottom hair loss, absolutely none. It looks like the hair just boop, fell out. And that happens. And sometimes it takes different geometric shapes because certain areas tend to fall out near each other, adjacent to each other, making a bigger area that may not be a perfectly discrete circle. Sometimes it's in the beard, and sometimes you lose the eyebrows, and sometimes the eyelashes. Now you start to get to alopecia totalis. And when you start to lose body hair, now you start to get to alopecia universalis. So those alopecias are the ones that benefit from the recently approved medications for alopecia areata. It's not to say that other types of hair loss won't improve. As dermatologists, we do a lot of stuff. We use things off label. Understand that your insurance will not pay for you to use something off label. So don't be mad at us. Don't be mad at your dermatologist because the insurance says that's not what it's indicated for. So we're not going to pay for it. So for those patients who do have alopecia areata, don't give up, seek help, try it. You know, we've been waiting for these JAK inhibitors forever, and they are effective. I have seen it with my own eyes. I still see it every day, and I treat folks and their eyebrows grow. Some people, I've seen the eyebrows first, and I'm like, oh my goodness, how wonderful. Or I see little spikes of hair, and then it gets a little fuller and a little longer. But that as well as a process, and it's not always a perfect process. It may grow more in one area than another, or, you know, but it's something to say that they're effective, and don't give up, seek help. And don't give up with any other type of hair loss that you've had, especially if you didn't seek help, and always seek another opinion. Okay? Take good care. Bye.